Well, the Prime Minister set the challenge last night to treble the rate of booster vaccinations to more than 1.2 million a day, offering all eligible adults in England one by the end of December. Scotland and Wales have the same aim. In Northern Ireland, boosters are being offered to people over 30. But how that is going to be delivered by health services is less clear. To add to the challenge, today the NHS website where people book their boosters crashed, while the UK government website where people order lateral flow kits was temporarily suspended. So the motivation amongst the British public might be there, but is the target achievable? Ben Chew is at the wall for us. Ben.
Yes, Emily. On Sunday night, the PM suggested his goal was effectively to get booster jabs to all adults by the new year. It's an extremely ambitious aim, and let's examine how ambitious. Since late September, around 40% of people aged 12 and over in the UK have been boosted, as this blue line shows. To get to full adult population booster coverage, 100%, as the pink line makes clear, would require a major increase in the booster rollout rate. So what does that mean in actual figures? Well, various estimates suggest around 20 million people in the UK are eligible and likely to be willing to get boosted. That implies roughly 1 million jabs would be needed to be administered on average every remaining day of this month. So where are we in relation to that at the moment? Well, the 7-day rolling average number of vaccines delivered, the yellow line here, is currently around 400,000 a day. So that would need to more than double to get to 1 million a day. The system has never achieved that before. The highest number of vaccinations in a day was on the 20th of March, when we very briefly hit 844,000. So can capacity be scaled up so rapidly? We're told that to make it happen, vaccine centres' opening hours will be extended, that there will be a national call out for volunteers, that the military will assist. We also learned today that vaccinations will become the priority of GP surgeries rather than routine appointments. Yet despite all that, many in the healthcare sector are still doubtful.
We will increase the pace of the programme, but I can't see us reaching 1 million per day for some time. At the moment, we're doing about 400,000 per day on average, so 1 million per day implies a nearly threefold increase from our current rate, which, given the fact that this was announced yesterday evening, I think is probably too radical a target, I think, for the NHS. It's good to mobilise people, mobilise the NHS. At the same time, any target should be realistic.
But is there wiggle room in the target? Listen to what the PM actually said on Sunday night.
A fortnight ago, I said we would offer every eligible adult a booster by the end of January. Today, in light of this Omicron emergency, I'm bringing that target forward by a whole month. Everyone eligible aged 18 and over in England will have the chance to get their booster before the new year.
Now, note that he said the jab would be offered by the new year, not delivered. He also said chance to get boosted, not will get boosted. And some have wondered if that means the real and less ambitious aim is merely for everyone eligible to be booked in for a booster, rather than everyone actually jabbed by the end of the year. Well, Downing Street has been pushing against this reading of those words today. Moreover, note that the PM also said this on Sunday.
To hit the pace we need, we'll need to match the NHS's best vaccination day so far and then beat that day after day. This will require an extraordinary effort.
Listen to that, and the bottom line is that the government is setting some very high public expectations for the increase in the pace of the rollout. Many observers doubt ministers will be able to avoid accountability on the basis of semantics if those expectations are not met. Finally, on the subject of accountability, what about businesses? Hospitality has not been ordered to close, yet, as we've heard earlier in the programme, many pubs and restaurants report bookings have collapsed in response to the ratcheting up of Omicron warnings from ministers. There are already calls for financial support and compensation. And if we do get further restrictions, even if businesses are still not mandated to close, we can expect those calls to grow louder and more insistent. Emily.